Invest Africa, proudly brought to you by KPMG.
As the year 2015 draws closer, the World Health Organization believes the world is within reach of its targets of providing anti-retroviral therapy to 15 million people. Reports show that there's been progress in every region, including in Africa, which has been lagging behind. This is in part due to a better continental response and the drastic reduction in the price of ARVs.
The epidemic has impacted so many people in every region of the world. According to the World Health Organization, in 2002, 3 million people died from the disease. That's over 8,000 people a day. Africa is referred to as the epicenter of the disease. It is home to 75% of all people living with HIV.
This epidemic has been with us for quite a number of years. In fact, we are right in the third decade of this epidemic. So the impact has been quite significant. It has been felt in all sorts of ways, particularly in the economic sector in terms of productivity, but also at community and family level, because the impact which comes from people who lose their work because they are not able to go to work, it has an impact on their own livelihood, on their families, on the communities that they provide for.
However, Africa has seen a decline in AIDS-related mortality rates in recent years. African countries have partnered to address HIV/AIDS and improve the health of Africans. More than 6 million people received anti-retroviral therapy in 2012 alone, this according to UNAIDS.
Well, I think the statistic is as follows. There's around 25 million HIV-infected Africans, sub-Saharan Africa that is, and around 38 million globally. So you can see most of the infected populations reside in sub-Saharan Africa. So when you've got that type of statistic, and of course not everybody is eligible for treatment, but obviously the longer people live with ARVs, the more you start seeing more and more people coming into the system. So right now, in terms of the 25 million in Africa that require treatment, that are infected, around 10 million or so require treatment. And we're treating about 6.5 million of those 10 million.
The African focus is now on manufacturing ARVs on the continent, as leaders seek to move away from a dependency on external sources for life-saving medicines.
When you're in a situation like we are here in South Africa, where you've got the worst disease, the worst HIV/AIDS disease burden of any country. So something like we represent 0.5% of the world's population, but we harbour 18% of our HIV, of the world's HIV prevalence. When you've got that type of statistic, it's crucial that you start establishing local manufacturing capacity and capability.
With all the progress made to help save the lives, there's been a positive impact on the supply of labour.
Today we have been seeing quite some significant changes in the way in which the continent and countries have responded to the AIDS epidemic, where we have seen progress both in terms of lowering the number of new infections, putting more people on treatment, which means that people are going back to work, they are living productive life, they're able to provide for their families.
Improved access to ARVs has helped prevent many children from being infected during the course of or after birth. The World Health Organization has it that mother-to-child transmission rates declined, overall from an estimated 26% in 2009 to 17% in 2012.
There's a target that we are likely to meet by 2015, is the target of reducing new infections from mothers to babies. In fact, if you look at the 21 or 22 high burden countries, in fact, most of them are making enormous progress in actually reducing transmission of the virus to the mother. So we still have babies born with HIV, and I think the moral imperative is that really there should be no baby born with HIV in this day and age, because if you look at America and Europe, there are no babies that are born with HIV today. We have the technology, we have the science that we can deploy to make sure that in fact no babies are born with HIV.
HIV/AIDS has had a damaging impact on the continent. but the combined African effort is reducing the social and economic impacts of the epidemic. Philani Nyalunga, CNBC Africa, Johannesburg.
Joining me now in the studio to take a closer look at the impact of HIV/AIDS in Africa is Alex van der Heever, independent health economist, Dr. Noluthando Nematswerani, the Discovery Health clinical specialist, and Dr. Don Pupuma, a family physician. Welcome all to the desk, and thank you so much for making the time to join us. Perhaps, Noluthando, let me come to you first. I mean, we heard the stats in that package. 25 million people living with the disease in Africa, representing over 69% of the overall infected population. Do we have anything to celebrate in terms of progress made thus far when the numbers are still so high?
I think we need to celebrate lives. People have been living positively with HIV. Yes, we do still have some challenges that we need to address, but there is a lot that has happened. So we are seeing reduction, for example, in prevention, in the mother-to-child transmission rates. We are seeing more and more people who are accessing treatment living for longer. So the life expectancy has improved, and we see that people are going back to work and they are contributing to the economy of the country. So there is still a lot to celebrate, even though we're not going to ignore our challenges in terms of making sure that we close the tap and prevent further infections.
And of course, one would assume that one of those key challenges, of course, is the infection rate. And let me come to you, Don, with this, and maybe let's unpack that particular element. Who is getting infected? What is the profile of this person that we're finding in Africa is still the most vulnerable to being infected?
The most vulnerable individual in Africa remains what we call mobile males with money. And that is because they are able to purchase sex in certain instances. They are mobile, they aren't at home, and therefore they tend to get other partners, and to a certain extent they're marginalized and aren't able to interact with family, and they remain vulnerable because of that factor.
Of course, bringing you in, Alex, there's always the economic impact of the disease on the general economy. Today we had South Africa's GDP's number coming out for the third quarter, 0.7%, very low. What is your views in terms of the impact of productivity that we see in the economy on the back of such a disease?
There have been many arguments suggesting that there is a very substantial impact. The real truth is that the impact is actually quite minimal on economic growth, and in some cases it's been overstated for a number of reasons. But the impact is on the capability of certain groups of people to develop, because it actually hits the most vulnerable groups of people more than the less vulnerable, more than the better educated and the people more likely to get employment. So you've got a protected part of the economy which continues regardless. And for the rest, the issue is how fast are they developing and getting into the modern economy, and that's the group that's being affected.
Let's look at that group in a little bit more depth, Alex. I mean, would it be right to make the conclusion that where there is vast amounts of poverty, that infection rates are likely to be highest in those pockets as well?
Well, it wouldn't necessarily be only poverty that's the cause, because, for instance, transactional sex, for instance, is an issue, and that means where you've got a disparity in incomes, for instance, between males and females in particular areas. So low educational levels for females will actually generate a greater degree of vulnerability to that particular context. So that's an area that it's not the poverty alone that's causing it, it's in fact the disparity.
Right, so we see where we're seeing inequality and disparity, infection rates are likely higher. But perhaps, Noluthando, let me come back to you and look at how businesses have responded to having a workforce that has a higher than before number of infected personnel. Have businesses responded in a way that is enabling in terms of working and to getting those numbers down?
Definitely, I think business has responded positively in the sense that, I mean, the testing campaigns that happen within the workplace, where businesses are encouraging their employees to actually know their status, because the start of it is really by knowing your status so that you can access healthcare earlier on. And also it's about saying, once you know your status, if you're negative, how do you live continue to live a negative life so that you don't contract HIV. So how do you prevent yourself from contracting HIV? So I think most of the companies have got workplace programs that actually assist their employees to do the testing. If they do require medication, also transition them to care. Specifically, we're looking at employees who are currently under medical insurance, like for example, people who belong to Discovery, to actually get into disease management programs, where they will access benefits that will enable them to live longer and more productive lives.
Again, I think we're speaking about a very small part of the broader population. And Don, I want us to perhaps take this conversation to the South African that's probably not working for Discovery, is not part of any medical aid scheme. Let's talk about their drive to want to know their status. Are we finding that the campaigns that are being rolled out on the ground, and even if we look at this from a South African context, are actually hitting home and people are walking into the practice and saying, I'd like to get tested?
The campaigns are being effective, and I think you make a profound point when you speak about which particular groups are particularly vulnerable. And it's people who are in the labor-intensive sectors, so for example, transportation, mining, construction, and all of those kind of areas where they typically wouldn't be able to access Discovery Health medical aid and that particular support. But the workplace and the campaigns that have been launched by government and by private companies have been pretty effective in the sense that a lot of those people are beginning to access A, treatment, B, testing, and beginning to definitely live longer lives and be productive and remain as part of the labor force, which is what we as a continent desperately need.
Yeah, a lot of employers are focused only on employees and not their families. And that in some cases they're avoiding that particular risk for the company, focusing on really what's important to them, but they're not solving a social problem. So the government services remain pretty important within that, but also to the extent that an employer is actually trying to provide some form of care. The question is, can you really provide genuine care if you're only treating half the family?
So that is a question where we leave it for the first half. Can you really provide genuine care if you're only focusing on your particular employee?